So if you do not wish to be recorded, please disconnect. This is collaborative. We'll have a breakout session, time for discussion after our speaker. And if you have any questions, need assistance, have any comments, please feel free to use the chat function. And if you would like to rename yourself to your name, title, where you're from, feel free to do that as well. I will pass it over to Dr. Jen Hall-Landy, whose bio I do not have pulled up today.
It's okay.
Before I do that, I do just want to let everyone on here know that this will be my last session. I'm moving back to my home state of Virginia, and I am passing over the role to my colleague Drake, who will be happy to answer any of your questions. So feel free to email him. I will send his email out to everyone who signed up for the sessions as well, just so you have that. And he will be sending all of your regular emails out from now on. So thank you, everyone.
Thank you, Courtney, and thank you for all your good work on this project. We're happy for you that you get to be home with your family, but sad for us. We'll miss you. So thank you. This was sort of Courtney's project that she took and ran with because the topic was of interest to her. So thank you for all your good work. So with that, I will just introduce, for those of you that have been joining us, first of all, welcome everyone. It's so nice to have everyone. I know it is the Thursday before a holiday weekend, and we appreciate you taking a little time out of your day. I'll just be very quick with our project scope spiel, because for those of you that have been here before, and I think most of you have, you've heard it before, but this project is Supporting Children of the Opioid Epidemic, Project Scope, and we focus on neonatal abstinence syndrome or neonatal opioid withdrawal syndrome, and we use the acronyms NAS and NOWS. We are a community of early intervention providers supporting children and family and learning more about this topic together, and we use the ECHO virtual training model. And every time we've told a little story about the ECHO model, but as everyone here likely knows, it stands for Extension for Community Health Outcomes. And we really follow several key tenets. We're virtual, we're online, we promote health equity. It's a bi-directional learning environment where we bring in experts from the field, but then all of you are experts in the work you do and have perspectives, and we share and learn together in this community of practice. Next slide. Oh, yes. And then again, some of the key tenets, the technology, the best practices. We'll do a family story at the end and to apply our learning, and please complete your survey at the end. We use data to monitor outcomes, and even more importantly, if there's anything more important than using data to monitor outcomes, is you will get your certificate of participation when you complete the survey for when you go to renew your license. All right, next slide, please. So today we are really excited to have session 5 with Dr. Traci LaLiberte on child welfare systems impact. And upcoming ones I'm always supposed to promote. Next week, we'll be talking about NAS and NOWS with a neonatologist, Dr. Fran Precker. Session 7 will be provider strategies for continuity of care. And session 8 is a really good one, African-American approach to family-centered care. Next slide, please. All right, and so we will get started. Dr. LaLiberte will talk for about half an hour. We'll do our family story / case study, and we'll have breakout groups, and then we'll end promptly at 4 o'clock. So again, welcome Dr. Traci LaLiberte. She comes and she's going to do her introduction, but she does come from the University of Minnesota like us, School of Social Work, and leads the Center for Advanced Studies in Child Welfare and the Child Welfare Training Academy. And we are so happy to have you here today, Traci. Welcome.
Thank you. It's nice to be here. Okay. Oh, so we're going to do slides this way. Okay.
Do you want to run your own slides? Because I can give you remote control.
No. This is good. This is good. That's a little much for me today.
Okay.
I did say that I would do my own introduction. We're living with a little COVID recovery in our house, and so I didn't get all of my materials as I probably should have to everyone. So forgive me as we go. As Jen said, my name is Traci LaLiberte, and I run the Center for Advanced Studies in Child Welfare. And the Center for Advanced Studies in Child Welfare, we refer to ourselves as CASHU, so you'll hear me say it as CASHU. We've been around for about 30 years, and it is a research and training center that was developed specifically to support people who work cross-disciplinary in the field of child welfare to support kids and families, both those in out-of-home placement, as well as those families who are living together and still navigating challenges in life and safety. I myself really consider myself and see myself as a practitioner. I have worked in the field primarily as an investigator for many years. And then really I started to identify problems that the child welfare system didn't work very well with people with disabilities and the disability system in general. And despite a lot of efforts and some task forces and things like that in the system that I worked in, I just made the decision it was better to go back to school and really try to do some structured learning around the systems and the challenges that are presented when two really, really big siloed systems try to work together. So that's where a lot of my research lives, is in the intersection of disability and child welfare, but not exclusively. I do lots of research, practice and training generally in the field of child welfare. So let's go to the next slide. I'm going to try to do what I usually do in a 2-hour lecture in about a half hour and give you the highlights of the child welfare system in Minnesota as we operate. This is Minnesota, right? We're Minnesota specific. And then I'm going to talk specifically about some new and revisited policies specific to supporting parents with substance use when they become involved in the child welfare system. So you can see we've got 3 learning objectives, and I think you're going to get copies of these slides. Really understanding our child welfare system broadly, but specifically in Minnesota. How do we define maltreatment? And then I wanted to talk a little bit about disproportionality across disability, race, ethnicity, and linguistic background, because those are really important issues in Minnesota's system. Next slide. I gave you a little bit of background on our center. We're located in the School of Social Work, and we have worked really hard to support people getting kind of forging careers in public and tribal child welfare across those 30 years. We primarily are funded through federal dollars, and so I always want to give a nod to our funders, which is USDHHS. And generally speaking, our mission is to improve the well-being of children and their families in the child welfare system within Minnesota. We also do work nationally and across the globe. Next slide. I don't know how your classes really go, and I know it said it's didactic, but just if somebody wants to monitor the chat, I am a very casual, interactive kind of presenter. So if you want to ask a question,
I'll do that for you, Traci.
Okay, so if anybody wants to ask a question, you can throw it in the chat or somehow, tag Rebecca. You're not interrupting me. I prefer that we kind of answer as we go along so that people don't sit with confusion or questions or anything like that. Next slide. So I think that most people probably are very aware in Minnesota, we have a state supervised, county administered system that's very different than other places in the country. And so child welfare is a very complex service system that is really very, very driven. I know a lot of people don't like to say this, but it is very driven along fiscal lines. And part of that, specific to Minnesota, is that we've got federal mandates and some federal funding, but then the state is supposed to implement those federal statutes on behalf of the feds and have compliance. But it's really the local entities that have to pay for that. And we know that some counties are better positioned with tax dollars and tax base to have an array of services than other counties. And so kids and families, as a result, get differential kinds of treatment and service across the state of Minnesota. That's really complicated when you're dealing with something that is imminent safety at a foundation. So we try really hard to look at those issues and continue to study those issues and create processes that will streamline and equalize some of those things across the state for kids and families. So as the state's role, they monitor our federal compliance, they set program requirements. We know DHS sends out bulletins that help guide what the work is. In Minnesota, we have 87 counties, and there's some consortiums of counties that are administered together, as well as 11 tribes, which means we pretty much have about 90 ways of doing things in Minnesota. And it does play out somewhat differently across the state. Counties are primarily responsible for funding. Next slide. I put the statutes in this slide, and again, you can use those as reference for your own knowledge later on in terms of looking up these statutes and what the subdivisions do. Minnesota does a pretty nice job giving some examples of what maltreatment is. I think my point on this slide for you to take away is if you're working with or going to conferences or collaborating across the country and things seem a little different with somebody else that you're talking to, it's because every state defines their maltreatment statutes differently and independently. There is a national resource. I can get that sent out. I've got some additional slides, so I'll update those and get those to Jen so she can get those sent out to you. But there's a nice resource that you can look at and compare maltreatment statutes across different states in the country. If you're interested in that, if you've come from another state or you're trying to collaborate with another state because a family has moved or something like that, and what do we consider to be abuse or neglect versus what another state does. If you're a data person, that should alert you to the fact that if all the states define it differently, then isn't the data a little bit muddled? And the answer is yes. What is abuse in one state is not necessarily defined the same way as abuse in another state. And so we just know that as we're looking at the data. Next slide. This is a real kind of basic picture of child welfare, the child welfare response system in Minnesota. Minnesota has a bit of a different response system in that we have what we call two paths. And I'll explain what that means. Most states or most people who know of child welfare have learned about, it's this involuntary system. Somebody has a concern, it gets reported, somebody comes out to the house, maybe with a police officer, maybe not. They do interviews and they investigate. This is how it plays out on Law and Order and Judging Amy and, all of our kind of contextual examples out of media. That is a traditional child welfare response, and that is largely the way child welfare is managed across the country. Probably about 20 years ago, somebody looked at data and many practitioners got together and said, this is not working. We are here to help kids and families just shut down the second child welfare comes to the door. And why wouldn't they? Because they're in trouble or they perceive they're in trouble. There's allegations against them, and it doesn't feel like a helpful system. It feels like the social service police have come to your house. So in many instances, much time at the beginning of a case is spent chasing families down, trying to establish rapport and relationships with families when you're dealing with very difficult, very complex things, including things like substance use and abuse, where people are already struggling with one thing and now you're adding in their kids and families. So a group of people got together and said, there's a different way to do child welfare. And they labeled it differential response. A different response to child welfare would be to not kind of come in with the hammer and say, you bad parent, tell me everything that you did. Now, that really isn't how child welfare is done, but that's how people experience it. But there's got to be a different way to partner with families to say, gosh, these things are going on. This seems really hard. How is it that we can help you? And what is it that you need? So differential response was born, and different jurisdictions across the country started to utilize that. Minnesota utilized it and felt as though it was a really effective way to also address racial disparities in terms of a disproportionate number of kids of color and Native kids not only being reported, cases being accepted, but then kids going into out-of-home placement, because there was this kind of up the ante throughout the process of the system. And so in Minnesota, that became a valuable tool in the toolbox, was to say, well, we don't have to go this traditional route. We have this alternative or differential way to go. And over the years, it has developed into two very distinct responses from child welfare. So if you look at the slide, intake is the same as the same as the same. You have a concern, a mandated reporter has a concern, somebody in the family, someone has a concern, and they call child welfare. They give as much information as they can. This is my concern. This is why I believe that. This is who I am. This is how I have that information, and as much information about the kids and family as they can. At that point, a team in Minnesota, a team now screens every report that comes in. A multidisciplinary team looks at that report and determines, does it or does it not fit the state statute, the requirement for whether or not a response is warranted or not. Because we certainly don't want people out investigating things that don't rise to the level that we as a community have said is the threshold for an investigation or an assessment. Once it's determined whether or not it's screened in or screened out, you can see if it's screened out, that's kind of the end. Parents could be offered services. This is the level of child welfare, but this family is really struggling with food insecurity, or this family might be struggling with housing insecurity. It's not a child protection issue, but the family has needs and they can refer them out for voluntary services. If the case is really, there's three responses. One is about a facility investigation. So that's if kids are in a residential or a group home or a school allegation against a teacher, something like that. So we're not going to talk about that today necessarily. The other two tracks are a traditional investigation called a family investigation. And an investigator has 45 days to do an investigation. And at the end of that 45 days, there's a legal determination of whether maltreatment does or does not exist. This can also include court. This can often include out-of-home placement. Cases, how it gets decided, which cases go to an investigation versus an assessment, is based on risk. If there is immediate risk, if the risk level is high, the child is very young, the child might not be able to protect themselves, the act is egregious, based in egregious harm or an egregious omission of care, that is always going to get a family investigation that's formal and has a legal determination at the end. All sexual abuse cases and allegations go family investigation rather, all of them. Family assessment tends to be lower risk cases, maybe kids who are older, basic neglect cases where families clearly need some service and some help, but there isn't necessarily imminent danger. In a family assessment case, there is, again, 45 days at the beginning of that case. The family, both of these are required, involuntary, 45-day investigation, 45-day assessment. The engagement might look different. It might feel a little different, but truly families should be engaged in either approach. Collateral contacts are made, other people are interviewed, talked to, and at the end of the 45-day assessment, the worker sits down with the family and talks about what they've learned, again, asking what it is that the family thinks the issues are, what the family might want help with or need help with. The worker might say, and here's what I've learned, and here's what I think. So here's what we can do. And there's an offer of service at the end of a family assessment. So the first 45 days, investigation and assessment, both involuntary, both required. At an investigation, a legal determination is made. And if that is found that maltreatment did occur and services are needed, that is an involuntary process that continues to move forward, perhaps with court involvement. At the end of the family assessment case, that 45 days, they sit down, they talk about it. There's an agreement that is made. It is not a legal determination that could impact where I live. It could impact my employment. It impacts a lot of things. And it becomes voluntary from that point forward. If the family says, get out of my life, then child welfare will leave their life. For many people, that's a criticism. If there was enough that was going on that you felt like you needed to be involved child welfare, why aren't you providing that service? And that's just the difference between those two approaches and those two tracks and the level of risk that is assessed at the time. Next slide. So I've talked through this mostly. You can see on the left, investigations, serious reports, imminent risk of harm, court and legal involvement. It is required. And services will be required if maltreatment substantiated. For an assessment, they're typically lower and moderate risk. They never involve sexual abuse allegations. Those have to go in an investigation. These are the needs of struggling families who are managing very complex issues. Strengths-based assessment is required that first 45 days. Services can then be considered voluntary. Next slide. I usually feel like this is a place people want to ask questions. Do we want to pause? Does anybody want to unmute and chime in? Or are we good? Curious how that family investigation works when there are split homes. Sorry,
Oh, like the child might live in 2 different homes
right
during the week.
Would it be best practice to have a conversation with both? Yes. So if there is a blended household or split household, both parents, child welfare will seek out to talk to not only the parents, but perhaps the extended family of both parents, people who the child identifies as an important person in their life. I think, our talk today is, comes at a difficult time. I think most people probably read the story about Eli Hart in the news last week. Eli was murdered by his mother. And that was a case that's very close to what this question is asking. It was a custody dispute that also involved child welfare. Those are incredibly complex cases because it becomes an issue of which court has jurisdiction, who's deciding which parent is actually the parent that the child will live with as assessments are being made, and where does safety lie and where does, where's safety threatened. So my quick answer to your question is yes, parents in both houses will be interviewed, should be interviewed, as well as extended relatives on both sides of the family. Sometimes it's not easy to find people. Child welfare has a history where, dads were really penalized in terms of how they were treated, what might have happened in terms of the dad and the mom's agreement about how the child was supported or not. And so it was hard to get a hold of dads. And I think as a system, we became quite focused on moms. I think we still are quite focused on moms. If you look at the way cases are open, they're often open in the mom's name. And some of that has changed over time, but much of that still remains, that the focus is heavily on the mom or the person that the child lives with, and the other parent is kind of other. And I think we are continuing to do work on that, and you know, sometimes better than others, for sure. I see more questions. Let's see if I can get in here. If that is true and we know about cases where this is not happening, who would we report it to? The director of the county, or is that the state? You know, I think that there's a number of places to go to if you are unhappy with how child welfare services are being delivered. Certainly to the supervisor of the worker is where I would start. If you feel like you're not getting a response there, I would go within the county to the child welfare or the social service director, depending upon if you're urban or rural, and how they're organized. You can always reach out to the state's ombudsperson's office. They will often get involved and at least call the county and advocate for, you know, a closer eye on different kinds of cases. And if the family is in court for some reason, usually the court will assign a guardian ad litem to the child, regardless of the child's age, if they can, you know, talk and advocate for themselves or not. A guardian ad litem would then be representing the best interest of the child, and you could always reach out to that attorney or representative. This slide, I'm trying to be mindful of the time, because you're welcome, Joni, because I never make my time marks, do I? Jen is watching my time because I am bad at that.
You need a little extra, that's fine.
I'm going to try to be good. I really am. So here you can see definition of neglect. And the reason that I put this up is clearly neglect is by and large the largest category of reports and investigations or assessments that take place. Neglect allegations largely are handled through family assessment pathways, but not exclusively. If there's imminent danger, especially like lack of supervision, you know, infant left alone for hours, you know, failure to protect a child, those kinds of things can certainly go an investigation track. And for real little ones, when the risk is real high because of their age, those tend to get an investigation versus a family assessment. So here you see neglect is also exposing a child to certain drugs during pregnancy, causing emotional harm to a child might also be considered neglect. Next slide. You can see here, this is 2019 data, and the 2019-2020 data is the newest data that we have from the state. So they're about 1.5 to 2 years behind on reporting data. This is the number and percent of alleged victims by maltreatment type. So again, you can see the vast majority of cases that come in are neglect, followed by physical abuse, sexual abuse, threatened injury. Mental injury tends to be very rarely reported, in part because of how difficult it is to assess and improve. Next slide. These are victims by response and pathway. So again, that facility investigation is the green one on the far left. You can take a look at that, but that's basically people who are not caregivers responsible for the child, but people who have a role in the child's life, like a teacher or a residential care provider, somebody like that. The brown color, those are investigations. So you see under sexual abuse, that whole line with the very small exception is brown, because those have to be investigated, not assessed. Remember those two pathways. The vast majority of neglect cases and physical abuse cases are assessment cases, but you can see that they are also present in investigations. And threats of injury, they're about split. Next slide. This I'm going to let you look at because it's kind of dizzying to have here on the screen. This is really about the relationship. I thought you might find it interesting when we think about who are the people that are accused of or alleged as offenders or perpetrators of maltreatment, and what is their relationship to the kids. So you can see everybody from non-caregivers and residential, those are those facility people, unmarried partners, so mom's boyfriend, dad's girlfriend, mom's girlfriend. Those folks make up 49% of determined investigations there. So biological parent is our largest category, followed by that unmarried partner, and then another formal parent role as a step parent. But you can see that there's lots of siblings are listed, daycare providers, relatives, things like that. Next slide. I put up mandated reporters. I assume that most people on this call in training are mandated reporters. There is a brand new mandated reporter training that is being developed at the Minnesota Child Welfare Training Academy. It's being piloted right now in the community, and that will be released, and you will have access to that. I will try to make sure, Jen, that I remember to send you a link, and even though this cohort may be done when it comes to fruition, you could always send a link out to people. So if you're interested, you could take that training, you could do the new, the newest training. But in lieu of that, there is a hyperlink in this slide that is an informational guide that helps mandated reporters know what to do, at what point to do, what kinds of things do you report, what kinds of things might you refer for service instead of reporting. Next slide. Disproportionality is important for us to talk about. It is a critical element. And just as people are calling for abolition in police and significant changes in the context of how policing is done, not only in Minnesota, but across the country, very, very parallel process in the field of child welfare. Where child welfare is really a field that has had a significant role, the leading role, in fact, in separating kids from families, particularly in communities of color and in Native sovereign communities. And so there really is a call to do child welfare differently, to not have the policing action, which really does align with some of that family assessment path that we have. But there are huge child welfare advocates that feel very strongly that that is a dangerous pathway, and they have tried for many years to eliminate family assessment as a method of engaging with kids and families in the state of Minnesota. So that continues to be a discourse that plays itself out at the legislature, as well as across all kinds of practice communities. I think particularly for people interested in chemical use and substance abuse, when you look at federal statutes, ASFA, the Adoption and Safe Families Act from 1997, for instance, is really the guiding and real forceful legislation in child welfare from a federal standpoint. And it attaches timeframes. Parents only have a certain period of time once a child goes into out-of-home care to kind of address their issue and get it to the point that it is manageable and that child can return home, or the state or county is required by law to move that child towards adoption. So think about that for a second. That's in federal law. Parents have a very finite amount of time. The state of Minnesota took those timeframes and made them shorter for younger children, with the understanding that developmentally, a 2-year-old being in foster care for 2 years might be different than a 14-year-old who's in foster care for 2 years. This is, 3/4 of their life if they're an infant, and attachment, things that we know affect all kids of all ages. And yet, That's what Minnesota chose to do many, many years ago. So if you're a parent in Minnesota and your child goes into out-of-home care and your child is under the age of 8, you have 6 months to address your issue. And I don't know about you guys, but I don't think many people kick a cocaine habit, a heroin habit in 6 months and have enough time to get into treatment, to have some sustained sobriety, and to be able to demonstrate over time the change in their parenting capacity. So while that federal statute was set out to really prevent kids from lingering in foster care, because through the 80s and 90s, kids just lived in foster care for years and years and years and had bad outcomes, right? The pendulum kind of swung too far the other way. And now the complexity of issues that parents face cannot possibly be remediated in the amount of time that we've set forward, especially when it's undergirded by housing insecurity and poverty and all the other issues that we know families are facing, and that differentially affect communities of color as well. So you put all of that together, and we've got multiple systems in which people have many, many health disparities, income disparities, housing disparities, and child welfare disparities in terms of how people are screened in, treated when they're in the system, and then how their children are and are not placed and returned. So if you look at this slide here, you can see that American Indian children, as of 2019, were 5 times more likely to be involved in an assessment or an investigation than white children. And that white children who identified, children who identified as 2 or more races and African-American children were 3 times more likely than white children to be involved in child welfare. These are really huge rates. So, okay, I got 3 minutes. I got to cruise. Thank you, Rebecca. These kind of rates are devastating not only to kids and their families, but communities. And it becomes multi-generational, that the effects of this have taken hold. And there's a great amount of attention that's being paid to it. And yet our numbers really don't change. In Minnesota, we are the worst offender in the country for rates having to do with disparity and disproportionality for our Native kids and families. So it's a really important element for people to be attending to if you're offering substance abuse services and treatment or assessment, to be able to recognize the need for culturally relevant and reflexive services is really critical. Next slide. I'm going to let you guys look at these. Next slide. There's 2 things. Next slide. Family story. Oh, so I have a couple slides that
You can go back to those slides.
I'm just going to use my own slides for a minute, not
Okay.
show them, but just talk. Use my
All right.
my notes here. One of the things that I did want to let people know about were 2 policies in particular. And like I said, I will send this to Rebecca or Courtney, or somebody will get these sent out to you, because I included some links to statutes. There is a federal law called CAPTA. It really is our foundational. It's the first federal legislation, the Child Abuse Prevention and Treatment Act. It was passed way back in the 70s and has just been amended and amended and amended over time. In the CAPTA legislation, it requires something called Plans of Safe Care, POSC. And those are specific plans that the state has to require, that counties also adhere to, that they have to put forward a plan to the feds about how infants affected by illegal substances are included in our legislation and our services. It was modified in 2016 through the Comprehensive Addiction and Recovery Act, and modified to expand the POSC, or the Plans of Safe Care, to include all infants affected by substance abuse withdrawal symptoms or a fetal alcohol spectrum disorder, and who requires services to be identified for both caregivers and infants. So it has always been in our policy, but it didn't get a lot of attention. The opioid epidemic, as we know, brought lots of attention to a lot of things. And again, we can talk for a long time about the disparity of community and race and how that has affected people and in the attention to some of these things. But I will give you a link to some resources around a plan of safe care. And Minnesota does have a plan of safe care that you can look at. And it is in several parts of the Minnesota statute in terms of how services will be delivered and to whom. The second thing I know I'm a minute over, but I'm going to do it anyway, Rebecca. The second policy I want you to be aware of is Families First Prevention and Services Act, or you'll hear people talk about FFPSA. We love our acronyms in child welfare. This is federal legislation that really aims to prevent kids from going into out-of-home care with the community belief that kids do better when they are in family or in family-like settings, and if at all possible, safely to be with their family with services wrapped around. It has lots of elements to this policy that really try to reduce or shut down residential care, that kids shouldn't be growing up in residential care or group homes. One of the things that pertains to you the most, that is most important for you to know, is that the FFPSA policy changed funding. Remember, I started this whole thing by saying we are really driven by funding in child welfare. And if a parent went into inpatient treatment, their child had to go into foster care. And the feds, through this policy, recognize this is craziness. We're trying to help keep families together and get mom clean and have her go into treatment. And then we make her have her kid go away. And then she gets out and then she's got to find housing and there it just, the challenges become exponential. And so this policy changed the funding so that when a mom goes inpatient, if the service provider will allow her to bring her child or children with her, the feds will reimburse the cost of the placement of those children in care with the mom. So I think it's Minnesota Adult and Teen Programming just sent something out today. Actually, I got it in my email about their new child protection program, which is designed to do exactly this, be able to keep moms and kids together while mom is doing inpatient care. And I know that there's other providers as well, but I really wanted people to be aware of that. I'll send out the slides so that you've got some additional statute and resources and links that you can follow. 3 minutes, so not bad.
That's great, Traci. Thank you.
Great.
Yes.
Go ahead.
I think I appreciate you coming. And as always, I'm learning new things from you every time. And I appreciate your sharing your expertise with everyone today. Thank you.
Thank you.
People can contact me too. Just send them my stuff, and Courtney, I'll send you the new slides now.
Sounds great. Thank you.
Thank you. Feel better.
All right. I think I'll just jump right in. Our next slide, please. So our family story for today is about a young mother named Lily Terrio and her family who live in Bemidji, Minnesota. Bemidji, as most of you know, is in northern Minnesota and a city of 12,000 people. So northern Bemidji, where the Mississippi headwaters start, or nearby. And I am not looking at Zoom anymore. I'm looking at my slides. So next slide. The background is that Lily is only 17 years old, so a young mom, and she lives with her grandmother and her mother in Bemidji. They're all Red Lake Anishinaabe Nation members. And Lily has entered medically assisted treatment, or MAT, since Jimmy's birth. And Jimmy is 1 month old, and he is currently at the Sanford Medical Center, NICU, due to low birth weight, and was born 3 weeks early with a congenital heart defect, which is not uncommon for early babies. And also Jimmy has NOWS. So symptoms, his particular symptoms are poor feeding and poor sleeping and tremors. And next slide, there are many strengths for the family. One is that the grandmother has offered to help Lily with the baby. And Lily had 1 month of recovery in MAT. Lily is also studying for her GED online, and baby Jimmy gets to go home next month at 2 months old. So, and Lily has been able to hold Jimmy daily at the NICU and care for him there through visits. Challenges and barriers are that Lily's mom and Lily's boyfriend, Jimmy's father, are still using opioids in the home, and the baby Jimmy is going to require expensive heart surgeries. And the grandmother in general distrusts experts, medical experts, after experiencing boarding school trauma, which we learned about a few weeks ago. And Lily needs to find a job to support her family, her extended family. The next slide. The 2 questions we'd like you to take on and break out, you can choose one, whichever your group likes. But question 1 is, does Minnesota have services as is that would not be suitable or sensitive to this family's needs? Go ahead and explain. Or you could cover, does Minnesota have services that are culturally responsive to this particular family? Explain. So you might say, oh, not this one, but this one as well. Okay. Is all that